Good morning to all the students. So if you see someone without a smile, give them one of yours. So today's topic is isolation and rubber dam. These are the contents. So introduction is, as a doctor, we take 3 vows to do no harm, increase patient comfort, and isolation is the key to that. So how do we classify? What are the isolation techniques? Moisture is the direct method, which can be done by rubber dam, cotton rolls, saliva ejectors, gingival retraction cord, mouth props. Indirect method are local anesthesia, drugs such as anti-sialogogues, anti-anxiety drugs, muscle relaxants. Goals of isolation. It should be control moisture, retraction and excess, harm prevention, safe and aseptic operating field, prevent accidental swallow, bacterial contamination from saliva, and local anesthesia. This is the history of rubber dam. It was first given by Dr. Stanford S.C. Barnum on 15th March 1864. Then 7 types of clamps with no forceps were used in 1870s. Then Dr. T's festoon clamps were introduced in 1870. Then this holds the history until in the early 20s, rubber dam frame was introduced by the Frenol as the name of Frenol's frame. So why rubber dam? It improves access, retraction and protection of soft tissues, dry operating field. It provides, improves visibility, provides aseptic environment, prevent inhalation of foreign bodies, patient management is effective, prevents cross infection and minimize mouth bleeding during sedation processes. So conditions where rubber dam should not be used are partially erupted teeth, some third molars, extremely malpositioned teeth, asthma patient, psychological reasons such as claustrophobia, and patients which are having latex allergy. So these are the armamentarium which we use for isolation using rubber dam. So rubber dam sheet comes in these thickness, which are thin, medium, heavy, extra heavy, and super heavy or special heavy, in sizes 5x5, which we generally use for smaller children, and 6x6 for adults or elder children. Then in color, black, green, green translucent, with the surfaces shiny and dull. So rubber dam sheets are made of latex, or non-latex sheets are also there. Rubber dam frame. Plastic frames are there, stainless steel frames are there, Frenol's frame, Young's frame, Starvizi frame, Nygaard Osby frame, safety frame, hinge rubber dam frame. These are some type of frames which are available. Then rubber dam punch, a precision instrument having a metal table and a pointed plunger, which is used to produce clean cut holes in the rubber dam sheet, through which the teeth can be isolated. The types are single hole punch or multi hole, which are made up of ivory pattern and ashen Ainsworth pattern. So this is the single hole punch. This Ainsworth pattern, in which multiple holes are there. This is ivory pattern. Then rubber dam forceps are there, which 3 widely used designs are Ash and Stokes pattern, ivory pattern. Most commonly uses Ash and Stokes pattern. Rubber dam stamp or template is there. It provides a very convenient and efficient way of marking the dam for punching. So rubber dam clamps based on the material are metallic, plastic, stainless steel, carbon steel, and based on the number of bores there are single bores, double bores, etc. Rubber dam retainers are the clamp which can be classified as winged or wingless. Then 3 methods of rubber dam application are there, 1, 2 and 3, which I am going to explain you. Placement of the clamp on appropriate tooth, then rubber dam is already punched, then spread over the clamp, then placement of the clamp, then clamp should be placed on appropriate punch hole on the dam, then dam already stretched over the clamp, and placement of the clamp on the appropriate tooth. In the third method, clamp is placed on the rubber dam and bow of the clamp only engages the dam. Held superior to the clamp, placement of the clamp and dam onto the tooth and placement of the frame. So advantage is that dam is not under any tension when it is placed, and Starkey recommended having a dental nurse to hold the upper corners of the dam to improve visibility while clamp placement. So how do you remove the dam? By cutting the septa, removing the retainer or removing, and then finally we remove the dam. Then we wipe the oral soft tissues, rinse the mouth and massage the tissues, and then examining the rubber dam. So what are the advancements? There are derma dam, insti dam, flexi dam, opti dam, handy dam, dry dam, opter dam and opal dam, which is also known as liquid dam. So this is derma dam, which is pliable metal frame which secures dam, improving the patient comfort. It has low dermatitis potential also. Insti dam is very stretchable, translucent natural latex, which is also tear resistant. Flexi dam is conveniently built in flam with the plastic frame. It is very much tear resistant and easy placement is there. Then opti dam is a 3D anatomically designed frame and dam which provide widened access, visibility and comfort. Then handy dam has excellent elasticity and tear resistance. That is why it has got some of the better advantages. Then dry dam given by Svenska, it does not require frame or harness. It is easy and quick isolation for the anterior teeth can also be done during this. Then opal dam or liquid dam is which you can apply on the gingiva also, and then curing is done and sealing the rubber dam leakage if any is there. Opter dam is very good for isolation of the anterior teeth. So this can be used effectively. So as to conclude, routine use of rubber dam is one of the greatest assets in pediatric dentistry, both to clinician and the child. It eliminates the problem of saliva contamination and interferes by the soft tissues that may contribute to poor quality restorations. Thank you.